So next, the presenter is Dr. Mangala, and she will be presenting Minocycline, a promising drug treatment in management of thyme keratitis, pythium keratitis.
Good morning, everybody. My topic is Minocycline, a promising drug treatment in the management of pythium keratitis. As we all know, pythium keratitis is a very dreadful disease, and it closely mimics a fungal keratitis, very difficult to diagnose. I am not going into deep into pythium keratitis. I am going to talk about few cases where we treated these cases with minocycline. So our case series were to report the successful management of pythium keratitis using a combination of minocycline and linezolid. All the cases were culture and stain proven positive pythium cases. We did just in the period of January, we started in Jan 2022 from our own hospital, Aravinda Hospital, Coimbatore. So we took 4 cases. Out of them, youngest was 17 and the oldest was 56. Only one patient had diabetes. No other comorbidities was noted. And one was female and other 3 were males. And occupation-wise, there was no correlation. All were different kinds of occupation: housewife, conductor, manual laborer, etc. There was history of trauma in one case and foreign body removal in another case. And 2 cases, they were not able to find out any specific cause. So at the time of presentation, they had all the 3 had pain, defective vision, and redness. These were their visual acuity, and these were the signs at the time of presentations. All of them had all these signs: feathery, tentacular spread, ring, a typical pythium presentation. Only one patient, he was treated as a fungal keratitis outside for a week, and even we didn't get that initial scraping positive, was not positive for him, but other 3, even the scraping was positive. Then after a week, he grew pythium. So initial microbiological evaluation, 2 grew pythium, 1 grew fungus, and 1 did not grow organisms. But after 2-3 days in culture, all the 4 patients were positive for pythium. That's why we took these 4 patients for our study. So all the 4 patients were initial treatment were given by 0.2% linezolid, 1% minocycline, 1% azithromycin, and homide. Oral minocycline was started for 2 patients, and oral azithromycin was started for 2 patients. So this is a clinical course of the first patient. That was a small boy who had 612. So first, all patients were started with medications. They were all admitted in our ward. So once we found out the tentacles were blunted, we discharged them after 1 week or 10 days. Then we were closely following up. But all the patients, we have to wait a long time. So then we started to notice conjunctivalization. The gutter started to form, and it was status quo for a few more visits. But we still continued our medications, and slowly it started healing. The epithelial defect started to heal. So this is our first patient. All the patients, we did confocal microscopy also, and it was also proven to be positive. So this was the initial presentation of the patient on February, and then on due course, he was scarring and all the scars started, and this is the final picture of the patient. Even though the scar looks dense, and further follow-ups, he was even able to get 6/9 partial vision. This is the second patient, the same thing. All of them were admitted, and then for him, ED started healing. But one thing is that patient had few follicular reactions in topicals, so we have to reduce it a little bit faster. But for him also, the ulcer healed. This is a clinical picture of the second patient. He presented to us in April, and we can see the gutter, all tentacular spreads and everything. So slowly it started healing, conjunctivalization, gutter formation. And to our surprise, actually I didn't get one more picture. There was a lot of vascularization, but on September, even the vascularization started healing so well. And this is the third patient. She is a female. She came with the initial presentation like this, and on due course, we can see all the tentacles blunted and scarring, conjunctivalization on all those things. And this is our 4th patient. This is the only patient where we had to treat him as a fungal keratitis for a week. Then after the cultures came, again we stopped antifungals, and then we restarted him on 1% minocycline, and this is the course of the patient. In all these 4 patients, we can see the globe integrity is maintained, even the vascularization reduced by the end of the treatment, and they're all doing well. So future we may go for keratoplasty. Why we wanted to start minocycline? Because in our past experience, we had 16 patients where patients were receiving these drugs when we saw the patient for the first time. All the patients were referred from many patients were referred from outside. Already they were on antifungals, antibiotics, and combination of treatments. Then we did our routine microbiological workup, and then routine treatment was started, like linezolid, azithromycin, linezolid, PHMB, all those routine drugs were started. But unfortunately, only one child had success in managing, but other 15 cases failure means they were large ulcers, not able to treat, and went for post TPK. Even in TPK, we can see 11 patients went for failed grafts, and 2 we have to eviscerate, and we had to do regrafts and peripheral recurrences. So we thought we will just go for another protocol, and then we, out of literature search, we went for the minocycline treatment. So now for these patients, we gave minocycline, linezolid, azithromycin, and both the treating physician as well as the patient need lot of patience, because it takes lot of time and at least 3 to 4 months to heal completely. But we were able to preserve the globe. This is a minocycline drug action. Mechanism on action. Actually, we prepared minocycline by mixing 100 milligram of IV preparation with 10 ml of sterile water, and we made of 1% minocycline, and this was given to the refrigerated and given to the patient. So pythium keratitis is not uncommon, and this drug is a promising drug. So early recognition is important, and general ophthalmology should consider pythium as a possible differential diagnosis. Thank you.
It's a nice presentation, Dr. Mangala. And the azithromycin has been proved to be very effective against these organisms. What is the advantage of this minocycline over azithromycin?
Yes, sir. We were giving these drugs only, linezolid, azithromycin, and all. But we in our cases we couldn't heal. Many of the patients went for large spread. Large grafts, recurrences, and graft melts and all. So out of interest, we went for a literature search, and we found out minocycline is another good promising drug. But in these 4 cases, sir, we could see nobody went for a perforation, or everybody whatever initial presentation was there, they were ulcers were able to come down in that size. They were not spreading. So we thought we'll go for a drug, and we tried. Actually, we were giving only azithromycin before, and it worked well.
So what is the shelf life of minocycline?
Shelf life we used to keep for a week.
A week.
We'll have 10 ml. So
and
after
any specific precaution for storage of the drug?
Sorry, ma'am?
Any refrigeration required?
Yeah, we have to keep it in the refrigerator.
Any specific temperature?
No, 4 degrees centigrade, madam. Normal refrigerator outside, it cannot be frozen. Outside the refrigerator, they can keep.
Okay.
Ma'am, this commercially available minocycline ointment can be used?
That we don't know, madam, but we one patient out, even in this preparation, he had lot of follicular reactions, and ocular surface was not good. So we thought we will go only by this topical preparation, which we mixed with an IV drug.
Okay.
Yes, sir.
Group of drugs which belong to the macrolide. Does it have any toxicity over the corneal?
Yes, sir. One patient we had a little bit follicular reaction, and that patient had little bit a longer time of epithelial healing. So then we had to taper, and so then.
Does have its toxicity over the epithelium. What was the concentration used of this particular drug?
1%.
Can you come this side?
1%.
Okay. Thank you so much.